Welcome back to What's Now. How has heart health changed, especially during this time of COVID? Well, I spoke with a doctor from the Cleveland Clinic all about a survey about how people need to be taking their heart health seriously. Here we go.
February is American Heart Health Month, and this year it falls during a pandemic. That's why the Cleveland Clinic's 2021 Heart Health Survey took a deep dive into how COVID-19 is affecting Americans' view of their heart health and heart care. Today, I am joined by Dr. Leonardo Rodriguez, staff cardiologist in the section of cardiovascular imaging department. Thank you so much, Dr. Rodriguez, for joining us today.
No, thank you for having me today.
So you work in the Department of Cardiovascular Medicine at the Cleveland Clinic, and I'm curious, February is American Heart Health Month, as I mentioned, and according to this Heart Health Survey, many Americans are more stressed due to COVID-19. How does stress affect heart health, and how are you seeing the stress from COVID-19 affect patients' heart health overall?
So the stress can affect the heart many ways, and we know that for many years. Patients tend to have a high blood pressure and also a high heart rate during periods of stress. And really in the extreme form of stress can also weaken the muscle of the heart, even transiently, and it's called the broken heart syndrome. And these times, of course, as you mentioned, is a lot of patients under stress. You know, they are concerned about the disease, either by themselves or their relatives, also the financial impact on their lives. So I think that we have seen that these patients in general are more stressed out.
And the survey also found that majority of Americans are more concerned about their heart health because of COVID-19. Is this concern warranted?
It is. COVID can have a direct effect on the heart. Also, patients with this condition, with the COVID, tend to develop clots more easily. So I think there is some true concern in that regard. A study with MRI have shown that maybe half or two-thirds may have some degree of damage of the heart muscle. So I think, again, it's better to avoid having this problem.
A concerning finding in the study was that many patients are putting off taking their medications because they are avoiding going to the doctor during COVID-19. What do you say to these patients that are putting off their heart health care?
I think you're right. This was one of the most concerning findings. Around half of the patients, even having symptoms, avoid contacting the doctors, at least going to see them face-to-face. And a third of the patients have to stop taking their medications either because their prescription ran out or, again, maybe because of financial issues. And for patients, it's critical to have these medications all the time. Again, they usually control the blood pressure. Sometimes there are blood thinners that need to be taken on a daily basis. So it's very important that they contact us to try to resolve these problems.
And what are some preventative steps people can take to prevent heart disease?
So we're going to say, like we say every month is a Heart Health Month. Try to eat healthy, try to exercise regularly, do not smoke, restrict or moderate alcohol intake. If you have heart conditions such as high blood pressure, please take your medications and check the blood pressure routinely, and try to keep your cholesterol levels within normal limits. And
where can we find more information?
They can go to our page. It's called clevelandclinic.org/loveyourheart. Great information there.
Well, thank you so much, Dr. Rodriguez, for joining us today and reminding us that February is American Heart Health Month and helping us know what we can do to keep our heart healthy and safe.
Thank you very much for having me.
Thanks for watching What's Now. I'm your host, Christine Napier. We're glad that you are here with us today. Be sure to follow us on social media. We're at Park City TV on Instagram, Facebook, and Twitter, and head to our website, parkcity.tv. Get all the information you need to have in order to watch your favorite station. We'll see you next time. Okay, I'm done.